So we'll be starting off with the upper extremity goniometric norms. Starting with our shoulder. For shoulder flexion, it's 180 degrees, the normal range, and then the normal range for abduction is 180 as well. For shoulder extension, it is 60 degrees, and then for external rotation, it is 90, internal rotation is 70. Going from our shoulder to our elbow, the normal range of elbow flexion is 150 degrees, and then the normal range of extension is 0 degrees. For the radial ulnar joint, the normal range of supination is 80 degrees, and then normal range of pronation is 80 degrees as well. Going on from our radial ulnar joint to our wrist, we have 80 degrees of wrist flexion, 70 degrees of wrist extension, 30 degrees of ulnar deviation, and 20 degrees of radial deviation. Moving on to our lower extremity goniometric norms, starting off with the hips, we have 120 degrees of hip flexion, and then 20 degrees of hip extension, 45 degrees of hip abduction, and then 30 degrees of adduction, and then for external rotation, it is 45 degrees, and internal rotation is also 45 degrees. Moving on to our knee, 0 degrees of extension is the normal range, and then 135 degrees of knee flexion is the normal range. Going on to our ankle, 20 degrees of dorsiflexion is the normal range, and then 50 degrees of plantar flexion is the normal range. For ankle eversion, it is 15 degrees, and then for ankle inversion, it is 35 degrees. And those are all the goniometric norms.